Asante sana mpenzi mtazamaji kwa kuendelea kutazama runinga ya TV47. Uko na mimi Emmanuel Terer. Minajili kubwa kukufahamisha kuhusu yale ambayo yanajitokeza asubuhi ya leo. Lakini najua unatafuta nafasi ya kwenda kutazama, kufuatilia filamu moja inaitwa Bloodshot. Inapeanwa nafasi na tiketi na Anga IMAX. Nina swali moja. Tangu asubuhi nimezungumzia sana mwelekezi wangu. Nataka unipatie jina lake kwa sababu ndo nimemtaja tangu tuingie hapa. Kama umekuwa unafuatilia mwelekezi wangu asubuhi ya leo amekuwa ni nani, niandikie jina lake na kupitia 22047 na vile vile kupitia Facebook ni TV47 Kenya, Twitter ni @TV47KE, vile vile @TererEmmanuel21 @Safan3, na kisha uanze kutumia #TV47KE, #TV47Breakfast, kisha unipatie jibu lako mpenzi mtazamaji. Lakini kwanza tupate trailer.
And initiate sequence.
Tell me, do you remember anything?
Do I know you guys?
I don't think so.
They've been manipulating you.
What you think is real sometimes ain't.
And initiate sequence.
Control me forever.
Sure about that? Revenge is what makes a man like you exceptional.
You know nothing about men like me.
That is absolutely fantastic.
I feel like I just heard this. Are they playing this on repeat?
Mpenzi mtazamaji, Anga IMAX bila shaka ndo inakupatia nafasi wewe mwenyewe ujitazamie filamu hiyo ya Bloodshot. Na kama unataka kujishindia tiketi, kumbuka ni tiketi mbili ambazo zipo leo asubuhi, na kuanzia asubuhi nimemtaja sana mwelekezi wangu mara kadhaa. Nitajie jina lake na nikufahamishe kwamba ni mwanadada. Sasa kama ulifuatilia na ukasikiza nikimtaja, nipatie jina lake, lakini anza kwa kuandika #TV47Breakfast, #TV47KE ili nawe upate nafasi ya kwenda kujitazamia filamu hiyo. Lakini tuzungumze masuala ya afya, teknolojia na vile vile bima, insurance, healthcare insurance na vile vile teknolojia. That's what I want us to discuss. Karibu sana, nina bingo moja anaitwa Awori. Mbona jina Awori bwana? Unasikiza mara nyingi sana ni Awor ama Owor, lakini yako ni Awori. Karibu sana bwana.
Asante sana.
Talking of healthcare insurance.
Yes.
What is it about?
Healthcare insurance, first of all, is one class of insurance whereby we're able to make sure that people outside there are actually covered in terms of risks, that is health risks, be it an illness, or if it's an accident. So if you walk around, you can contract this major disease called corona.
Okay, so you're also insuring corona?
Yes, the insurance industry is covering corona. However, we do cover it at an early stage. That is at a stage whereby you go to a clinic, just receive some tests, we cover it. But thereafter, you'll be, of course, referred to the government facility, which has been stipulated by the government.
Okay,
so we are covering it.
So someone should not be too much afraid when it comes to payment towards corona. Now, why are we moving digital? US is different from what I normally know. The insurance you go different, it's not digital. But now US is moving with the technology.
Yeah, first of all, that is good. I want to answer that question first of all by taking you back to our platform.
Okay.
Yeah, I come from Bridgecap company. So at Bridgecap is a group of companies. It's a financial company where we do three things. We do insurance as one bit of what we do. We also do financing and advisory. So in insurance...
When you say we do financing and advisory, someone is watching and would want to understand much about financing and advisory.
Yes.
Okay.
In financing, actually, we are basically targeting small, medium enterprises, whereby we actually able to support their projects that are maybe if you have a project and you have some financial issues, we can come in and support you financially so that your project can be able to continue. Yeah. Also, we do that is business advisory services, that is accounting services, cash flow management, so that we make sure that your business is ready actually in terms of investment. So we make sure your books are ready for investment capacity.
What are some of the terms on your policies?
Yeah. First of all, we make sure that our clients, first of all, actually we are effective in terms of what we're offering, and also we are flexible in services, and capacity building is also key in our policy method.
When you're talking about the flexibility, how flexible is set? When you say someone knows very well that when I go to a different insurance company, there'll be a big flexibility.
Yeah.
But I would want to understand, you're talking about flexibility in your company. What is it when you talk of flexibility?
Yeah. Now, that is why I'll go directly to our Endelea platform. Our Endelea platform is actually a digital platform that we have invented to help us actually sort this issue that is in the insurance industry. You've realized currently the Kenyans are actually facing a major problem when it comes to high medical bills. So you realize whenever you're admitted into a hospital, there are very high medical bills that comes with the same. So not many people will be able to afford that service. So they opt going the traditional way, like seeking traditional way of treatment because they cannot afford the better facility. So our Endelea platform, actually we've decided to come up with a very flexible product that will be able to cater for these people who cannot afford the high medical costs by actually coming up with a flexible cover, a product that is cheap, affordable, and can easily be accessible wherever you are. So that is why we've come up with the Endelea platform. Now,
So are Kenyans embracing insurance generally in Kenya?
yeah. When you look at the statistics broadly, you realize 91%, around 91% of Kenyans, they are not covered. They cannot, they're
Why?
not on cover. Yeah, because we are experiencing, we have high poverty level in the country. We are also still a developing country, so...
By looking at your age, you seem to have entered into insurance so early, man. Are you able to train someone also to follow your footsteps and avoid the fact that you're talking about poverty in the country?
Yeah, you realize the youth are the ones who are driving the country currently. So by embracing insurance, we are trying to make sure that we bring out these innovations that are currently coming up, like the Endelea platform, so that we drive the insurance industry and make sure that we hit those, we make sure at least a bigger percentage actually be able to access insurance services. So the youths are the future of this country.
So it means even new people are giving out trainings whenever someone is in dire need of, I want to understand what is meant by the insurance. So for how long are you training someone to go in accordance to what you want?
Yes, basically when you join our insurance platform, we do training. We do a thorough training probably on now the digital platform. We make sure you have the information. And also we do training to clients so that they embrace this insurance and this digital platform.
Are you only limited to these people who have smartphones? Because I know someone somewhere akushago anataka kuelewa that how am I going to venture into the digital world of insurance when nikiwa nyumbani?
Our Endelea platform, first of all, is a very easy digital platform to operate. Yeah, because we use a USSD code, whereby whichever phone that you have, be it a small kabambe or a smartphone, wherever you are, you can just dial *251#, then it takes you to a digital platform, so you can access it using any smartphone that you have. So it's a service that is accessible to anybody, so long as you have a phone.
So who verifies that this is really a certified insurance?
Basically, we have a regulatory body called Insurance Regulatory Authority, who regulates all conducts of the insurance. So we are good.
So someone who is watching right now is young and yearning to join in using his innovation digital. The simple way to go is, when you want to make this one a certified one, you go to the insurance body that regulates.
Yes.
Okay. Are you facing any challenge in your platform?
Currently, the platform is okay. It has been tested. It's working well. And currently, the clients are happy with the platform. So at the moment, there are no challenges. The platform is working well. Yeah, because basically how the platform works, you realize we have designed in a way that it is more efficient, so there are less loopholes on the challenge that is likely to operate. A case example, how the system operates. Whenever you take your phone, you dial the code that is *251#. It will take you to the platform, where it will just ask you for your details, your name, your date of birth, and your PIN number. Then
are you creating PIN numbers for people that you need to create first, and then you have the PIN number?
Not really. We advise the clients to have the PIN numbers for themselves, so that when you come, you just put in, because at the moment it will increase the turnaround time of processing that cover, and we are trying to make sure the system is efficient enough so that we try to shorten this processing time. So if you again take into account start making PIN number for people, again we'll be making the process to be slightly longer. So once it takes you to that digital platform, you key in your details, it will take you to the benefits. Now on the benefits, you'll be able to see the kind of products you are offering, be it Endelea Plan, be it Endelea Plus. So you have the benefits there. You are able to read and understand what you are purchasing. Then once you've understood, you choose on the package that you want. Then it will take you back to the amount that is the subscription cost that you're likely to pay. Then once you see you are contented with those, you just put in submit, and you get a notification.
There's something that you've mentioned at Endelea Plan and Endelea. There's something in Endelea Plus.
Yeah.
So what are the differences between the two?
In our Endelea Plan, actually, we've categorized into two, because we've looked at the healthcare system, the kind of challenges people are facing there when it comes to the healthcare. People normally goes to the hospital because of one accident. Whenever you get an accident, you'll be admitted, you'll go for any checkup or whatever. So that one we've categorized that benefit as Endelea. Then you can go into the hospital. It can be out of accident or illness. So in an event you go maybe out of illness, we've categorized that as an Endelea Plus. So Endelea Plus is actually both illness and accident hospitalization. So that is how we have come up with the two products.
Selling products are you getting any competition?
Competition on the digital platform?
Yes.
On the digital platform, I can confidently say that there are no much competition, but on the insurance, general insurance, of course, we have many insurance companies for your competition. So what you're trying to do, you're just trying to be slightly ahead of others by now coming in with the technology to outdo the traditional way of doing insurance.
Okay.
Yeah,
So if I take the product,
Yes.
the maturity period, how long is it?
First of all, the normal maturity period applies when you enroll into a cover. We normally give 30 days for you to be able to be covered on illness. But if you're going for outpatient facilities, we only take about 7 days to process your cover. Actually, less than 7 days. We can say 4. To be able to process your cover, you get a notification, then you are on cover.
Okay. I don't know, but I guess it's a real challenge for someone to sell the insurance.
Yes.
The selling part of the product doesn't seem so swift. How
Yes.
do you normally deal with this digitally, if in a digital way, compared to someone who is selling face on?
Yeah, it has been a perception that selling insurance is hard. But I can confidently tell you that selling insurance is not hard. It depends on how you do the selling. Yeah, the traditional way of doing insurance is what was making people see that it's hard. Because people could go to a client, you walk, look for a client, you do the manual way, you work with forms. Yeah, you have to take the forms to a client, fill, you return, so it becomes a tedious work.
Okay.
Now, nowadays with the technology, we've minimized all those steps. Yeah, so doing insurance has been made easy by just dialing a code. You are able to see your benefits. So what we can do is just make sure that people knows about the code and the product on the digital platform. Then you are good to go. So it becomes so easy and like.
So digital is the way to go, to be precise. But then at the end of the day, someone is afraid.
Yes.
Maybe, how are the securities? If enrolling with your platform, if I want to, how much am I protected?
First of all, we've taken security measures for the client products. That is why we comes into the agreement terms and conditions before you submit your details.
Okay.
So before the law, we actually cautioned. We make sure security of our clients' details is actually our utmost priority, so that we make sure your client are not leaked anywhere. So
that's a big protection. So again, the bigger side of it is, these people would want to know, I know someone watching and saying, are you going to give me a chance? I'm young and I want to work with you. I'm creative. I want to see myself in your Endelea platform. How easy is it to get a chance to work with you?
Actually, it is so easy to get a chance to work with us. At Bridge Cup, we are a company that is actually key in making sure that we develop, we grow people at an individual level, and also ultimately we grow as a company. So we welcome people, especially the youths.
So long as must you have some level of education?
Yes, of course, because of actually making sure the standards and the code of conduct for the people we're enrolling is up to standard. We make sure at least you qualify. You have
what is the minimum?
A basic qualification for you to. I'm sure for you to enter any job, you must have a basic qualification.
Okay.
Have a college certificate at least.
Okay.
And also have some knowledge, some background in.
But if I don't have the background knowledge on insurance, are you training people?
Yes, we train people now on the digital platform, because with the digital platform, you're able to use the system well. And if you're able to use the system well, you are not the one who customize the benefit, because the benefits are customized by the underwriter. So once the underwriter has customized the benefits, it's so easy for you to make sure that we just use the system. So it is so easy. Yeah.
So even the USSD code is not that complicated?
It's not a complicated. Just dial star 251 hash, and it takes you to a digital platform.
Is there anything that will be cut from my credits? The money that I have, maybe, are you charging anything on that?
Actually, USSD code is
Free?
It's actually a message like, so it will cost around 1 shilling, Bob.
Oh, that's a bob.
Yeah, Bob.
Okay.
Like any other message, sending any other message.
Okay, so it's really simple. So using you need only a bob and then you done sending the code. Mpenzi mtazamaji, bila shaka ni nafasi yako sasa kupata kufahamu fika kwamba unaweza kwenda digitali katika masuala ya bima au insurance, ujipatie nafasi ili wewe mwenyewe upate nafasi kubwa sana ya kuendeleza masuala haya. Asante sana kwa kusalia nasi. Labda nisome arafa moja kabla tukamilishe. Kuna bingwa moja kupitia Facebook bado anaendeleza swala lile la gazeti, anasema kwamba while Raila is busy with reggae, Uhuru is busy implementing BBI. Bomas reports, stop living in utopia. Where do you get good leaders? The word sober has its meaning on paper. That's the reality. Naamini kwamba alikuwa na mjibu Philip Etale. Asante sana kwa kusalia nasi mpenzi mtazamaji. Bila shaka kulingana na awali jinsi ambavyo nilikueleza awali ni kwamba kama ndio unapata nafasi ya kutazama Bloodshot kupitia Anga IMAX, unaweza jipatia tiketi ya kwenda kutazama ile filamu. Lakini swali langu ambalo niliuliza awali ni kwamba tangu asubuhi nimekuwa namtaja mwelekezi wangu ni mwanadada, anaitwa nani? Nipatie jina lake rasmi mpenzi mtazamaji, ili nawe ujipatie tiketi. Kumbuka kwamba unaweza andika kutaka kutuma arafa yako, anza na #T47KE, #TV47breakfast bila shaka, ili nawe tupate nafasi ya kufaulu. Kuna mtu ambaye anakuangalia sasa hivi anataka kuelewa, what do I do as a young person? What are the biggest innovation that I can? What is your biggest advice?
The biggest invention that a young person should learn going actually is any kind of invention that will make sure that we are going the paperless work. Because it's through this paperless work that many companies are suffering, that many services are not being efficient.
Okay.
Like, let's say in insurance companies, how you can reduce that paperwork that are ensuring that you take like 2 weeks to process your medical cover. How do you make sure that you minimize that paperwork? How do you make sure that you do a soft policy document delivery to a client? How do you make sure that this client doesn't have to come to your company to know what you are selling? How do you make sure that you make sure this payment for this client is actually flexible enough? The client can pay in installment, and like paying a wholesome amount. And all those are the kind of things that Endelea plan is actually looking at. So if a young person can go that way, I think it's a good invention that can be to him.
Asante sana Wori kwa kujiunga nasi asubuhi ya leo. Nashukuru sana kwa sababu ya mtazamaji vile vile umekuwa nasi tangu asubuhi. Ni wakati huu bila shaka tunakamilisha. Asante sana, na usikose kwamba kesho pia tutakuwepo na burudani. Ndakuwepo hapa, kutakuwepo na wacheshi na vile vile muziki aina yake. Lakini saa 1 Alhamisi siku ya leo ndakusomea taarifa habari nikiwa na mwenzangu Liz Mutuku. Usitake kubonyeza kibonyonyo ikifika wakati huo. Na shukuru sana kwa wale wote waliofanikisha makala haya mpenzi mtazamaji, na hakikisha kwamba unaendelea kutuma arafa kupitia 2207 na vile vile kuwasiliana nasi kupitia Twitter ni @TV47KE, @Safan3, @TerereManuel21 na vile vile kupitia Facebook ni @TV47 Kenya. Asante sana kutoka kwangu, nasema salia na Mwenyezi Mungu. Kumbuka kwamba kunao mkono ukishanawa usipeleke kwenye uso, na vile vile kwepa sana kugusa pua lako na vile vile masikio na mdomo, mpenzi mtazamaji, ili sisi sote tukabili janga hili la COVID-19. Najua Mwenyezi Mungu yupo tayari, imenyesha kunaonyesha kwamba hii inaondoka. Jina langu ni Emmanuel Terer.
Coronavirus, COVID-19.